morning, everybody. First of all, I would like to thank Seva, Santé Animale, and especially Pedro and Alessio for their kind invitation to give you this talk about the role of Q fever on cattle reproduction. Maybe you know or not that Q fever, the name of Q fever, comes to the fact that at the beginning there was a lot of question about this disease, which was very well unknown, and then it's Q for query fever. And we can wonder today if this query aspect fits also with the fact that Coxiella boneti infection is, yes or no, associated with reproductive disorders. So the main topic of my presentation will aim to make a sort of exhaustive review of the literature about the evidence regarding the association between Q fever and reproductive disorders in cattle. But maybe just a few words in introduction to remind you some points about Q fever, and especially the fact that it's both a human and animal health issue. So as you probably know, Q fever is a zoonosis, which in most of the cases is asymptomatic because after an incubation period of 2 or 3 weeks, in most of the cases, 60%, it's asymptomatic, so no clinical signs in humans. And when acute disease occurs, it's mainly a flu-like syndrome, okay? The most problematic situation is the implementation, the occurrence of a chronic infection, which occurs in between 2 and 3% of infected persons. And the most, let's say, problematic clinical signs occurred in a susceptible person, especially those with cardiovascular disease, and then the infection leads to endocarditis mainly, and also in pregnant women, in which chronic infection leads to abortion, fetal death, and premature delivery.